Happy New Year, everyone. It has been a crazy time to say the least, but I hope everyone had a very happy holiday season and the end of 2021. We're now on to 2022, where it's going to be a new year. It's a new time, and unfortunately, we're dealing with a lot of the same stuff, but hopefully things are going to be better this year than last, and I wish you all the best. That being said, I'm glad to be back with our Facebook Live. This is, I think it's the first time in several weeks that we've been on. This year we're going to be doing a lot of fresh new things with our Facebook Lives. We are still going to continue on with talking about various musculoskeletal injuries, pain conditions, different body regions. So if you have any specific things that you want me to discuss on our Facebook Live, then please contact us. If you like what you're seeing, then like, subscribe, all that fun stuff. But if you have something that you want us to talk about, please DM, comment, or email us at info@fxregencenter.com. In addition to talking about various musculoskeletal injuries and pain conditions, we are going to be talking about some other interesting things in the weeks to come. We're going to be talking about nutrition and medical weight management. We're excited to bring some new things into our practice in the coming weeks and months on those fronts. We're going to be linking up with some other healthcare practitioners, some physicians, as well as nutritionists and others that deal with various different aspects of our health. So we're looking forward to having some guests on this year. And we're even going to be talking to some health advocates. There's one person that comes to mind, a patient of mine, who is a very, very big advocate, and we're going to be talking about a lot of different things, including ranges of topics from hypermobility to ADHD to how to actually be an advocate for yourself. And piggybacking off of that, one of the things that we're going to do periodically is talk about how to be proactive and trying to have this different mentality when it comes to your health. The majority of healthcare these days is reactive, meaning you get an injury, then you get a treatment, right? You find out that you have diabetes, so then you get on medications. Something happens, so then you do this, right? It is reactive, meaning that we're reacting to what's going on to us, which is an important thing, which is an important factor to consider and a very critical part of healthcare. However, when we really think about health care, what we really should be talking about is being proactive about our health. And that means a lot of different things. That means taking care of ourselves to prevent things from happening, right? Preventative care in order to optimize our bodies, to prevent injuries, to prevent illness. What are the things that we can do there? But it also is a matter of when we have things going on with ourselves, whether we want to be proactive or reactive, is how do we take control over the things that we can take control over, right? The reality is there's a lot of things. If 2020 forward has shown us anything, there's a lot of things that we don't have control over. We don't have control over a virus. We certainly don't have control over policies and politics and all of those things that are involved in our lives on a day-to-day. But we do have control over certain things. One of the things that some of my patients have come to me in the past and said that they have had a challenge with is that when they go and see a physician, they don't feel like they're a piece of the conversation. They don't feel like they're truthfully a part of the team taking care of themselves. And there's kind of an old school thought process with medicine that it really is paternalistic. It's like, hey, this is what's going on. This is what you got to do. These are your options that you have, but really, this is what I'm telling you to do. This is what you need to do to take care of yourself. Now, to a certain extent, physicians, other healthcare practitioners are very well researched and studied and educated, and really are in the most optimal position to make appropriate decisions. However, it's so important for patients to be knowledgeable about what's going on in their bodies and to be an advocate for themselves. Part of that involves making sure that we have the right team around us, right? If we see a physician to take care of our knee, for example, or whatever condition it may be, making sure that we're on the same page with that physician, and making sure that we have the right opportunity to get our questions answered, making sure that we have the opportunity to discuss the different options that there are and evaluate what is the best option for me. And sometimes that's not an option that the physician actually has for you. But it could be an option that the physician is referring to somebody else, or recommending some other type of treatment or management, right? But that brings us to our topic. That's a long-winded introduction to our topic here, but that brings us to our topic today of the value of a second opinion. It is very commonplace that we end up seeking out care and ending up feeling trapped with the options that we have, and seeing that there's this is the treatment that's laid out for me and this is what I have to do. We see this a lot in musculoskeletal medicine. We see that a lot in pain management. We see that a lot in orthopedics. Because what happens is we get an injury, or we have an issue that occurs that's causing pain, that's causing functional limitations. We go to our primary care doctor, who may refer us to a orthopedic surgeon or to a specialist that will then lay out the options for care, which sounds like a reasonable pathway to go down. But what happens when you're being referred to an orthopedic surgeon, but you're not really a surgical candidate, right? A lot of times we'll see someone that has a knee issue. So they see their primary care doctor, and because it's the knee, they go to then the orthopedic surgeon, which is your knee specialist, right? But reality is that's a knee surgical specialist, and they may not be a non-surgical specialist. Oftentimes we are left with the options of, okay, you are a candidate for surgery, and this is what I recommend. If you don't want to do surgery, then you can go elsewhere, or you can go to physical therapy, or you can go and get an injection. But we're limited by the options that particular physician, provider, etc. has for the patient. So when someone says that, oh, you know what, that's the only choice that you have, if somebody comes to a surgeon with a meniscus tear in their knee that's causing pain, that surgeon might tell them that, we need to do an arthroscopic surgery. That's the only solution for this condition. Well, that may be the only solution that particular physician has for that solution. That might not actually be the only solution available. And, I'm dogging on surgeons here, but the reality is that this happens to every single physician out there. You only have the tools that you have. Right? You only have the tools that you have. Now, some physicians like to be open-minded and say, you know what, all right, you're coming to me for the option of surgery, but I don't think surgery is appropriate. I'm going to send you somewhere else where you can get the appropriate care. There's a lot of surgeons that are really, really good at noticing and understanding when surgery is not actually appropriate. And likewise, there are a lot of non-surgical physicians like myself. When somebody comes to me and they need surgery, even though they're coming to me to try to avoid surgery, I'll tell them straight up, look, surgery is the right option for you. That is the right solution, and I think it's important for us to recognize when somebody falls into our wheelhouse of treatment options, or when somebody needs to go somewhere else, right? But especially in the insurance world, when you may only have 15-20 minutes with your medical provider, they might not have the chance or opportunity or time or wherewithal to be able to go through all the different potential options for you. So their job is to say, all right, these are the options that I have. Go make your decision. So that's why the idea of a second opinion is so important. It's so critical for us to recognize that, just because you're going somewhere and you're told this is what you should do doesn't mean that that's the only choice that's out there. So I just realized I have this whole screen up and I'm only taking up a corner, and I should probably draw something or write something in order for you guys to see what I am saying. So I'm gonna say that the number one reason why a second opinion is so important when you're taking out care is because a physician is not God. So I'm saying this as a summary of the fact that a physician is not the all-knowing being that we kind of used to portray physicians as 20-30 years ago. Not all physicians know everything. It is impossible for us to know everything, and that's why it's very, very important to seek out multiple different viewpoints. So that was number one. Number two is that especially if a surgery is the thing that is being offered, or really any treatment that has potential risks associated with them, any treatment that has potential negative outcomes. So a surgery, an injection treatment, cortisone injections, even medications, right? When there are risks associated with it, we got to take a step back. We got to always look at the risks and benefits that are associated with that. And if the benefits clearly outweigh the risks, right? If the benefits clearly outweigh the risks, then yeah, perfectly reasonable to go forward with that type of treatment without necessarily getting a second opinion. An example for that is something that I recommend to almost all of my patients as a frontline treatment is something like physical therapy. Getting the body moving correctly, exercising, strengthening the muscles, but really, focusing on function, right? Getting the body moving correctly. So, although some people get injured in physical therapy, I argue that yes, pain could be associated with physical therapy, but ultimately getting the body moving correctly is probably one of the most important things. Now, the benefits of that outweigh the risks substantially, because even if we get the body moving correctly and we have zero pain relief, we have no benefit in terms of our symptoms, well, we're still getting our body moving correctly, right? We're still moving in the right direction. At the very least, we're preventing things from getting worse, right? With the risks being very low. So when you weigh out your benefits and risks, really, really important. It's not always necessary to get a second opinion, but when we have the potential something of a surgery, right? I'll give you the example of an arthroscopic knee surgery for a degenerative meniscus tear. At this juncture, there's been research that shows that arthroscopic surgery, or getting a scope, or getting cleaned out for a degenerative meniscus tear, number one, is no different than placebo, and number two, has the real potential of causing arthritis to worsen. Now, there are some circumstances where that surgery is absolutely necessary, but given the potential risks associated with it of actually causing arthritis to get worse, and given the fact that this is a one-way street, once you go down this route, there's nothing that you can do to reverse that. Well, yeah, that's certainly a time that a second opinion can really be important. So when we're facing irreversible things, irreversible treatment, TX, by the way, is shorthand for treatment. So when you're facing an irreversible treatment, that's really an important time where we want to make sure that we're getting a second opinion. Not only irreversible treatment, but anything that has risks associated with it that have the potential of outweighing the benefits, right? So now the final thing is that a lot of times people will go to a healthcare practitioner because they were told that they're the best. They were told that they have, you know, these credentials or whatever it may be. But you go there and you don't feel like you're being heard, right? You don't feel like, you know, the physician's looking at your imaging and saying, all right, this is what's wrong with you. This is what has to be done. But they're not listening to the words that are coming out of your mouth. I think that this is an important time for us to take a step back and consider something along the lines of a second opinion. Because I'll tell you, there's a lot of patients that come to me that say, hey, you know, I have this knee pain and my physician's telling me I need cortisone injections, but the last 2 cortisone injections did absolutely nothing. And then when I talk to them and I actually listen to them, they say that their knee pain is involving the back of their knee, and it travels down their calf and travels up their back of their thigh into their buttock, and oh yeah, by the way, I had a history of back pain in the past, and then I examine them then, and I'm listening to what they're saying, and yeah, there's some pain associated with the knee joint itself, but listening to the description of their pain, I realize that this is coming from their back the whole time, right? Yeah, of course the cortisone injection in their knee didn't help. This is coming from your back, right? So it's so important to listen to our patients, and as a patient, it becomes critical that if you don't feel like you're being heard, that you need to, number one, talk to that physician, and number 2, see if there's other people that you may see eye to eye with better. I'll give you an example. Actually, I had a patient recently, and this is the first time this has happened, but she actually contacted my office and said, hey, I actually felt uncomfortable with an interaction that I had with Dr. Patel, and she, you know, my staff was like, why don't we get him on the phone with you? And I talked to her, and I realized that we had a miscommunication in terms of, you know, how to interpret the directions that she had for after her procedure, and in that miscommunication, she felt as if I was not listening to her. And I felt horrible. I felt horrible because it was such an important conversation that we needed to be having. And I thought that we were on the same page, and we were not. So in apologizing and in realizing that we had not seen eye to eye, we were able to reconcile, and I think we actually grew from that experience. We ended up being on the same page, and now we're actually looking forward to her next phases of her recovery and her treatment plan. But the point of me saying this is that, you know, if you try to reach out to your doc and you don't feel like you're seeing eye to eye with them, I think that's definitely an important reason to see a second opinion, because there's a lot of folks out there, and I don't jive with everybody, right? There's some patients that come to me and say, you know what, this guy talks too much, or whatever it may be, but we have to be able to see eye to eye with each other when we're taking care of a situation, because in the end, you are a part of the team. You are the most important part of the team taking care of you. So it's really important that we make the correct members of that team. You know, we need that all to work in sync, and that's why it's so important to get a second opinion, because, you know, ultimately we need to see eye to eye, right? So overall, there's a lot more reasons to see a second opinion, right? I actually give second opinions across the country for a consulting company, and And I see a lot of people that are lined up for inappropriate surgeries. I see a lot of people that are lined up for appropriate surgeries, but they're confused and they just want some more information, right? So there's a lot of reasons to get more information. Even lowering healthcare costs is another reason, right? There's so much unnecessary stuff that ends up being done, where if we find the right team that we line up with, that we can take care of yourself, then a lot of unnecessary costs could be circumvented. So there's a lot of reasons to get a second opinion. I'm always a fan of it. If you ever see me for consultation, you're like, you know what, I want to see somebody else for an opinion, I am all about it. I think it is so necessary to get viewpoints from different perspectives. But to summarize, not every physician, not every healthcare practitioner knows everything, right? Doctor does not equal God. When we're thinking about irreversible treatments, especially things like surgery, got to look at the risks versus the benefits. And when we're thinking about something, if we have any glimpse of doubt, then it's important to get a second opinion on that front. And then finally, making sure you see eye to eye with your doc. So important. And I hope that all made sense. So all in all, be an advocate for yourself. And if you enjoyed this video, if you like this, then please share it. Looking at my comments, Kathy said, Happy 2022, Happy New Year, Kathy. Thank you so much for always be supportive. And I'm looking forward to seeing you more as we do more of these. Looking forward to seeing you all. So if you have any questions, concerns, DM, comment, and message us or email us at info@fxregencenter.com if you have any thoughts about future topics. And otherwise, I will talk to you all soon. See you next week, and Happy New Year.